Welcome back to the Patient First podcast. How you doing? I'm glad you're here. Thanks for joining us once again, where we're looking, of course, to make you more profitable by putting the patient first. And today we have kind of a challenging topic to talk about. It is the elephant in our offices. It sits there with our patients and us trying to ignore it as much as possible, hoping it will move on and leave us alone as we just go to work. There's a few topics that are kind of like that in dentistry because we're so busy doing so much work in our practices day by day that sometimes there's some factors that are easy to ignore and easy to ignore as they kind of are slowly degrading the foundation of dentistry as we know it. Am I catastrophizing? Well, you be the judge because our topic today is dental insurance. Right. It's kind of the big baddie in the room that's really necessary. And it's frankly of our own design. When dental insurance first got going, it was a bunch of dentists that came up with this idea, right? And I think there's a great place for dental insurance. However, it's not really, we got to discuss what it is. So, first off, we need to talk about what dental insurance is, what it isn't, and, stop complaining about it. Really just look at it and, maybe not catastrophize. However, I do think frankly, I think having it eroding the foundation of dentistry in general, I don't think that's catastrophizing. If you look at kind of what's going on, I think it fundamentally has to change over time. But that's not what we're talking about today. Today, we're talking about what is dental insurance and how does it affect our practices. Really, it's a dental benefit, right? As we all know, this isn't insurance. If you have a major catastrophe, dental insurance is capped out at maybe half a tooth, right? If you're doing a root canal and a crown, $1,500 40 years ago when they set that limit, you could probably have your whole entire mouth restored. Today, you maybe can fix a tooth. So this is a dental benefit, as we all know in dentistry. It's not insurance. It's kind of wrong to even call it insurance, as we all know. But the good news is because it's been degrading, I think everybody in the industry kind of recognize that. So first, to kind of unveil what dental insurance is and how we can adjust our practices in line to kind of not catastrophize the way things are, but adjust to the way things are so that we can grow our practices by putting our patients first, which is again, like I started this podcast, I start every podcast. And the whole purpose of this podcast is what it's all about. So let's start by saying what dental insurance is from the perspective of us, the dental professionals, our practices, everybody who works in the dental industry, other than dental insurance companies, dental insurance, and frankly, for them too, it's expensive marketing, right? So it's a marketing expense that frankly is getting more expensive year over year for the entire time I've been in practice, the last 22 years. It has gotten more expensive to market leveraging dental insurance. So we need to look at it this way as an industry so that we can use it for what it is, which is expensive marketing. Nothing more. It's not a safety net for our patients, as we all know. It is really just a way for people to get a benefit from an employer that points them to your office, and then you reduce your fees based on that contract with the dental insurance company, which frankly I've met with dental insurance companies. They've told me that they don't even understand, like, how, I mean, they understand it. When a patient comes in your practice, it is so hard to verify what's going on. There's a whole industry of dental insurance verification, which is great, but core issue here is that we don't even really know what's going on with their dental insurance. It changes all the time. Like Darth Vader said to Lando Calrissian, I'm altering the deal. Pray I don't alter it any further. And that's really what we've been doing, is praying that the dental insurance companies don't alter the deal any further. And we know, as did Lando, it was going to get worse every year, as it has for the last 22 years that I've been in practice. There's not been a year where I've been like, oh boy, the dental insurance has made my job easier. But but again, it's not their job to make my job easier. It's their job to make their marketing more expensive. And they've done a very good job at that. Now, whatever downstream, we'll talk a little bit in a bit how to adjust to this from my perspective. But realistically, look at your practice and judge, is this marketing worth the cost? Or should I shift the marketing dollars to a different expense? That's kind of the, distilling it down. That's really what I want to drive home today, is that we are not beholden to these insurance companies. We have a business that we're running. They have a business that they're running. Our patients have lives and finances, and it's our job do what we can that's best for our patients so we can deliver the highest quality of care possible to as many people as possible. So we can elevate as many people's oral health and frankly, overall health as possible. So, how do we do that? We look at dental insurance for what it is and not for what it isn't. It is not some massive benefit for patients, right? It's not a safety net. It is expensive marketing for us, period. So, look at it that way. And I know it's hard sometimes to look at the finances of your practice and figure out what's going on and tell patients that you're dropping their insurance, right? Or that you're because your insurance has shifted, their insurance has shifted over time, that it's become too expensive for the practice. But the dentists that I know that have had those conversations, it's gone very well. So that's dental insurance, I believe, from our perspective, expensive marketing, plain and simple. Look at it that way and nothing else. That's the hard part, is not to bring in all the patient communication and all of that, but just frankly, drastically looking at it for what it is, which is expensive marketing. So, from the patient's perspective, what is dental insurance? I believe it's just the deal. They're Lando Calrissian. The deal's just getting worse all the time. I mean, have you ever talked to a patient in the last couple of years and had them say, "Oh boy, my dental insurance is great"? When I got out of dental school 22 years ago, and I know I'm Grandpa Laskin here talking, but patients would only do things that their dental insurance covered. One of the things that helps us as dentists is that this expensive marketing has gotten worse for patients every year, to the point where I don't know a patient that I haven't talked to a patient in the last at least 5 years, probably decade, that really thinks that the dental insurance company is looking out for them. Not one. Maybe I have a better educated patient population than most, but I think that's true. I think that patients recognize that the deal's getting worse all the time. And the premiums, let's face it, are often about the same as the maximum payout. So the patient, the employer is losing no matter what happens. That ain't insurance. And because that's the state of where it is today, not where it was 30 years ago, but where it is today, people recognize what's going on, right? And so, what really set me off, and I've been talking a lot about dental insurance lately, is what happened during the pandemic. Because medical insurances, I know, were like giving premiums back, and people were still going to the physician. Dental patients could not go to, because what happened with dentistry not being an essential service, that whole thing that started, if you remember at the beginning of the pandemic, patients weren't going, they physically couldn't go, legally couldn't go unless there was an emergency to a dental practice. But guess who was collecting premiums that entire time? Dental insurance. And I mean, that's really set me off. I was like, not only is this expensive marketing, how many people called up their SEO, their Google AdWords, their website company during the shutdown and said, patients can't come to see me. We should turn this off, right? How many people called the dental insurance companies and said, I can't go see the dentist, stop my premiums? I don't know. I bet a lot. And they didn't. They kept collecting those checks. So that set me off and made me think, why are we doing this? It's like, or at least let's not be the complacent chump in this scenario, right? We have some power here. Lando didn't just get bowled over by Darth Vader, right? He did something about it. And I don't think we need to, this isn't really the enemy. I think that there's a great place for dental insurance. I think employers helping support their employees' dental benefits obviously is a big deal, but it's gotten too out of whack. The deal has gotten too bad in a lot of cases, but it's hard to make the changes, right? We all know this isn't insurance, but a crappy benefit that employers feel obligated to give to their employees. But it's lumped into medicine, like the medical plans. So dentistry is much less expensive than medical insurance. And frankly, there is medical insurance and a dental benefit, which kind of gets lumped in with it. So we're kind of like the add-on, right? So I think that's is relatively clear now. At least what I think from the dental professional's perspective, we should look at dental insurance as expensive marketing. From the patient's perspective, it's just frankly a deal that used to be good, that's gotten worse over time, and now it's a really bad deal, like my man Lando right here. So the big question is, of course, what do we do about it? Well, I think there's a lot of hope here because, as I said, everybody understands, including dental insurance companies, that there's a lot of raw deals out there. So the short answer is we have to adjust. And I think dentists are adjusting. I hear that from lots of dentists every week that people are adjusting. And so that's my call to action here for you, is to evaluate what plans you participate in and look at them for what they are, which is expensive marketing, and adjust accordingly. That's all. And then you might want to augment some additional procedures, some different techniques in order to make your practice more independent from dental insurance. So I did that 20 years ago. I started that, and here's some examples. Number one, have a membership plan. So if you have the right membership plan to attract patients that don't have dental insurance, they won't leave. It's like your own dental benefit that you have in your practice. I love membership plans. They take all sorts of flavors. I think there's some really good ones, there's some okay ones, and of course, just like everything, there's some that don't work very well. But you have to check with your state, and but having a membership in place in your practice for patients that don't have dental insurance, I think, or anybody, frankly, but obviously it's set up to be more attractive to people that don't have dental insurance is huge, because then you set the stage. You control your fee schedule, you control the discounts. Again, it's just another way to take the discount of marketing to attract more patients to your practice. But in this way, you are controlling how expensive it is, and you can turn the dial whenever you want to, not whenever somebody, they send you a notice and say, based on the contract that you signed, here we have full power to do whatever we want to, right? So number one is a membership. Number two is what I like to call golden handcuffs. And we talk, of course, this is about being more profitable by putting patients first. So when you put patients first, what you do is you design systems in your practice that overwhelm patients with joy so that they don't want to leave. Things like a whitening for life and a mouth guard for life program. We're doing an entire course at Upgrade Dental on producing golden handcuffs. That's probably not what we're going to call it, but basically having systems where you're providing services in your practice that are so great that nobody ever wants to leave. For example, a whitening for life program. What does that mean? It means that every time that a patient comes in, they can get some whitening material. They come in, we give them some whitening material. If you know what, if they go to another practice, will they get that? Probably not. So are they more likely to stay in our practice because they know that they don't have to pay for whitening when they come in? Yes. Now, that is just one small, easy example of golden handcuffs. And you can, if you start doing that over again, adding systematized ways to you where you build a moat around your castle so that people don't want to leave. Again, the reason why they're golden handcuffs is because people are choosing to stay because it's such a good deal. That why would they go anywhere else? That's what it's all about. And that's putting patients first in a way that makes you more profitable, which is what it's all about, baby, right? So then beyond those things. So number one, a membership plan. Number two, developing your golden handcuff initiative, and we'll help you out at Upgrade Dental very soon with that course. Then also marketing to non-insurance patients. So what does that mean? And why am I saying that? Because it seems obvious. If you have a membership plan, factor in part of the expense of your marketing plan, the marketing of that plan outside the walls of your practice and internally too, of course. Obviously, internal referrals are number one, number two, and number three, and then look to external referrals. But part of your membership plan should not include just the discounts for patients. It should include the marketing that you're going to spend, the dollars you're going to spend to let people know that you have a membership plan, because you want to get people outside the walls of your practice to know that this is available. If you don't have dental insurance, come here. We've got your back. We've got you covered. You don't need to have dental benefits, dental insurance, whatever you want to call it. It's commonly called dental insurance, even though that's not what it is, as we've talked about. So make sure to market it outside your practice, right? Number four is to look at your profitability. And I'm beating this drum heavily on this podcast recently because I think profitability is plummeting in dental practices right now. So in particular, when you look at your profitability, you may see you're losing a lot of money on specific plans. If you're losing money by treating patients on a plan, drop the plan. By definition, you will be more profitable if you drop a plan that you're losing money on, right? If you're losing money, you either have to change what you're doing, which probably doesn't make sense because you probably have good reasons why you're doing what you're doing, or you need to adjust the compensation model, which makes a lot of sense in today's world where there's inflation and wages are exploding and all the other negative factors that we have going around us. So, and part of raising your rates means dropping crappy insurance. And why am I hammering this home with about dental insurance profitability, marketing your membership plans, and producing golden handcuffs? It's because I talk with dentists every single week as part of my Insanely Productive Dentist Workshop series, which is now sold out. And it blows my mind right now that it's sold out, because we thought that we could see as many people as possible. But we're having new cohorts all the time. So go to upgradedental.com and get in line to join the next group of insanely productive dentists. But there's a lot going on right now in our industry that people are looking to adjust their practices to. And at IPD, as we like to call it at Upgrade Dental, Insanely Productive Dentists, we help dentists with leadership training, with marketing, with attracting and retaining team members. And so a lot of the hot button issues that I think really have been exploding right now, that I think there was a training void in the industry that I'm happy to fill. And so it's my honor to produce this and be part of it every single week with the dentist going through it. It's a 16-week modular series that really shows you how to become an insanely productive dentist, develop an insanely productive operatory, have an insanely productive office, and then the fourth month is all about having an insanely productive team. So how do you retain, attract team members? And we talk a lot about the golden handcuffs, some of the systems to develop golden handcuffs, and a lot about basically how to be more profitable in the insanely productive dentist. So to learn more, to get on the list, go to upgradedental.com. Thank you very much. I look forward to seeing you next week on Patient First Podcast.